A Bay Area health clinic is now offering coronavirus antibody tests to the public. Joining me now is the CEO and founder of Carbon Health, Dr. Djavaherian. Thanks for talking with us.
Thanks for having me.
So we actually hosted a panel at the start of the outbreak, which you participated in, and now we're in the thick of a full-fledged pandemic, and your health clinics are making these tests available. Tell me about the journey that brought us to this point.
It's incredible. I mean, we went from, I think at the time of that panel, having maybe dozens of cases in the US to now having tens of thousands, unfortunately. And along the way, I think we've learned quite a bit about how to test for this virus, how to monitor it, and frankly, making sure that we can start to get back to our normal lives the way they were before this virus hit.
And so what is the hope that these antibody tests will do for us?
So these antibody tests are sometimes hard for the average consumer or patient to really understand what it means. I think most people are interested in knowing, am I at risk for having coronavirus? Did I already have it? Do I have some sort of immunity to it? And unfortunately, what this test does is that it tells you very accurately if you have not had exposure to coronavirus. So if you end up testing positive for coronavirus with the antibody test, which is a blood test that we run, it says that basically you've had some sort of immunity to one of the types of coronavirus. And unfortunately, we don't know whether that means you're immune from this pandemic deadly virus or if it was one of its cousins. But if you test negative, with near complete certainty that you have not been exposed to this virus and that you need to continue to be careful. So that's a nuanced message, but an important one for everyone to understand before obtaining the blood test or the serology antibody test.
And my understanding is that there is still some debate whether having recovered from the coronavirus and having the antibodies protects a person from getting sick again with that virus. Is that how it is?
That's right. And unfortunately, it's actually too soon to tell. So we're not quite sure. We haven't been deep enough in this pandemic to really understand whether or not having antibodies to this virus means that you're now immune in case it comes back. I think the best evidence currently is that there's short-term immunity, perhaps a month or two, but we don't know about longer-term immunity. So if you test positive to the serology test, and we know that it's coronavirus because, let's say you've had the swab in the past and the swab was positive, then, when patients ask us, does that mean I'm in the clear in the fall if this virus kind of resurfaces? The answer is we don't know. So this is incremental information for the patients out there, but it's not really kind of telling them what most people want to know, which is, am I now fully immune to this?
And so although there's so much uncertainty that still surrounds these antibody tests, what kind of a benefit could this possibly provide to a person, at least emotionally or mentally?
That's such a great question. Thank you for bringing up the kind of emotional, psychological component to all of this. So if you've had an illness 2 or more weeks ago and you were convinced that it was coronavirus, and you kind of want to know, was that coronavirus? Is there a way for me to tell whether that's what I was dealing with or not? This would actually be a good test, because if it comes back negative, it'll tell you that, frankly, that likely was not the coronavirus that you were dealing with. If it's positive, especially when it was, in situations where you've also had the swab test, then you know that that likely was the coronavirus. Now, just to be frank, it's again too early to tell whether having had a mild case of coronavirus means that you won't have a more severe case later on. That's currently our expectation, but frankly, we're too early in this pandemic to really understand whether that's the case or not.
just so many questions that still remain needed to be answered by people who are, of course, feeling a little bit frantic at this time, but at least it's some sort of assurance that maybe if they beat it once before, they can potentially do it again if they get reinfected. These tests aren't available at your mobile sites, is my understanding. Can you tell us a little bit about where people can get it through Carbon Health, how long it takes, and when they can see those results?
Absolutely. So through our mobile sites as well as in our clinics, we have the PCR test for the virus, which is incredibly accurate if you test positive. So if you end up getting the swab test, which often is in the nose or in the back of the throat, and you test positive, you can tell with a high degree of certainty that you actually are currently infected with coronavirus. And that's a fairly easy thing to explain to patients. So if I test positive, it means I have it. With the serology test, unfortunately, because it's much more nuanced, we couldn't just test people and let them go on with their lives. Because the idea is that if you test positive with the serology, so this is the blood test, the antibody test, we really need to speak to you about what your specific situation is and whether or not what you experienced before could have been coronavirus. So that's why we actually don't offer it today in our mobile center. We really need to kind of have a face-to-face interaction, allow you to see one of our doctors or clinicians and talk through your individual scenario so that we can discuss what your current risk is and to make sure that there's no misunderstanding about what a positive or a negative test result actually means for you.
How long does the test take, and then how long for the results?
Yep. So the test is actually about a half a milliliter of blood. We send it off to our partner labs, and the results are, we're told, take about 24 to 48 hours to get back. So of course that might change depending on how overwhelmed those lab facilities become. But we're expecting at this time about a 1 to 2 day turnaround on those results.
Person might have been already infected with the coronavirus and they beat it. What kind of a period of time do they have to wait before taking an antibody test for it to be accurate?
Thank you for asking that question. So this antibody test is looking for a protein in your blood called IgG. And typically that antibody protein starts to develop when you've been exposed more than somewhere between 4 to 10 days after your symptoms start. So if you're in the midst of dealing with an illness and you want to know whether that's coronavirus, you should still come to one of our centers and we can test you for an active infection. But it really wouldn't necessarily benefit you to know whether you have antibodies at that point. So typically we would want you to be somewhere between 4 days to 10 days away from the illness to know whether you've developed some sort of antibody reaction to the virus that you were dealing with.
And how are you guys confident with the accuracy of these results?
So, uh, so we were very, very, very careful about which testing companies we worked with and which tests were used for the antibody testing that we're doing. So unfortunately, we've all been inundated in the medical field with companies, often from overseas, that are selling tests that have not been allowed to be used under the FDA's emergency use authorization. And as an organization, science for us comes first, medical care comes first. And so we worked with lab companies where the FDA either had already authorized the emergency use authorization for the serology test or was in the process of authorizing it and allowing them to use serology testing in their facilities. So we have really the best in class tests available today. And again, with a near 100% certainty, and then frankly, the range is somewhere between 95 and 100%, we can tell that if you test negative, that you actually have not been exposed to coronavirus.
And going back to the fact that you said if a person tests positive with this antibody test, it doesn't necessarily mean that it was the current form of coronavirus that we're all concerned about given its strength and its potency. But how do you end up differentiating between maybe other types of cousins like SARS? Are there other maybe symptoms that were coupled, with this positive test that people can look at and say, you know what, maybe it was COVID-19?
Really, it's in cases where we marry the swab test with the serology test, where we'll get the highest degree of certainty about what you're exposed to. So these antibody tests, unfortunately, are not accurate enough to distinguish between the whole family of coronaviruses. And so, unfortunately, unless you fall into the category, and actually many people would fall into this category, but if you fall into the category of needing the swab test as well as the blood test, we won't know for certain whether or not it was coronavirus or not, causing your illness. Now, if we have the swab test result plus the serology, the certainty becomes much, much higher. And that's why the clinicians, the interaction you have with one of our providers at the clinic is so crucial for how this works. And actually, let me clarify that. We also do this through telemedicine. So we can do consultations afterwards with telemedicine through video visits. So after your results come back, one of our providers can reach out to you through a video visit and frankly explain to you as a patient what a positive or a negative test means. And this is something, frankly, that we're proud of at Carbon Health, where we can marry, in-person visits where we draw your blood or do an examination, have an initial consultation, but we marry that with the ability to follow up with you very closely and make sure all your questions are answered before we allow you to kind of make assumptions about what your test results mean.
Is this antibody test out of pocket right now, and have you guys been able to discuss any of the costs being covered with local, state, or even the federal government?
That's a great question. So we're assuming that insurance companies would cover this test. There is a diagnostic billing code for this test, and it seems like following the same path as the swab test, where that's essentially free for everyone, because the state or the federal government has created funds to allow for those testings to occur in people who don't have insurance. We expect that the serology testing will be covered by insurance, but frankly, we're kind of at the forefront of this, so we're not 100% sure.
All right, thank you so much, founder of Carbon Health, Dr. Cesar Djavaherian, for joining us.
Thank you so much for having me.
You're watching Chron On, the Bay Area streaming news 24/7.